Hi there, folks. This is Dr. Ellenburg. Welcome to my medical show here on Fox News Talk 1020 AM. We're also on FM at 95.5, and we're also online at foxnewskoan.com. Questions about your health, questions about our medical topics today, give me a call if you'd like. It's 522-1020. That's 522-1020. And before we start, some reminders about where you can find me during the week when I'm not on here on Mondays from 2 to 3 p.m. You'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. That's doctor for short, so drellenburg with a u.com. Check us out, list of our services. We also have suggested websites, learn more about your health and things in the environment that affect your health. And we also have suggested reading as well, certain books you might find interesting that could benefit your health. And we also do have archived radio shows on drellenburg.com. Check us out at our site. I do see patients in Kenai Monthly and in Palmer. Please give me a call at 563-2366 for times and dates. And away we go. So, missed last week due to some family reunion, but it was, hope you guys enjoyed a repeat show. Sometimes it's good hearing things over again. And today we're going to cover a host of topics I want to go over. It's always good at least once or twice a year to talk about gout. I want to talk about the new study that came out recently talking about vitamin D that was entitled No Match for the Common Cold. We're going to talk about magnesium in relations to diabetes and depression and also muscle spasms. And we'll also be talking about weight loss on the guise of, first of all, sleep and how that affects it, and how you can eat at certain times of the day, in this case, eating breakfast, and how that will make a big difference in your ability to lose weight, or if you're going to be gaining weight in that case. And then last but not least, we're talking today about lead exposure. There's been some new guidelines released by the Centers for Disease Control, lowering the level at which they consider it to be a problem for children. And, of course, this will also apply to adults as well. And as always, if your questions about medicine are not about our topics, that is all right. That's okay. Give me a call. It is a live call-in show. We do encourage your phone calls. Our number here is 522-1020. That's 522-1020. All right, let's get into it. So gout is a condition that can affect many people over their life. It typically has to do with the amount of uric acid that is accumulated in your body. And that can have a lot to do with, one, the type of diet you're eating or things you're consuming. For example, a diet of high red meats, a diet with a fair amount of alcohol in it can increase your risk of developing gout. What is gout? Well, we have these little uric acid kidney stones that can develop in our blood and end up lodging in some of our larger joints. And typically one place we see it a lot on folks who get gout is usually maybe in the ankle or also in the big toe. Knuckle right there as it comes into the top part of the foot. Some main areas. You could also get uric acid kidney stones, which is not gout, but it's an accumulation of uric acid. And a lot of times, too, in patients where we see this happen a lot, that beyond diet is a lot of times they're just plain dehydrated on a regular basis, and that can increase your risk of developing any type of kidney stones as well. But with gout, there's been an interesting study that was talked about on naturalnews.com. Check them out. Interesting site. Lots of things about natural health and your in medicine, and they cover a lot of different areas. This one was talking about a study that appeared in the Journal of Arthritis and Rheumatism, and it appeared here a few months ago talking about people who had an increased risk of developing gout, and if they were to increase their intake of cherries, either dried cherries or fresh cherries, but in this case, most of the attacks were lowered in those who previously have gout attacks if they were eating the fresh cherries. And I've had people even, another popular product out there is a cherry bark extract that people have used over the years that I've ran into and had good luck with that with gout as well. So what and how would this stuff even work in the body in the first place? Well, we have a little enzyme in the body, well, many enzymes, of course. This one's called xanthine oxidase, and An enzyme, if you don't understand that word means in medicine, is really anything that makes something happen faster. It's kind of like a catalyst. It speeds things up. And with xanthine oxidase, if you can inhibit that, you can decrease the formation of uric acid in the body in general. And one thing that does that very well actually is vitamin C. So you actually could use vitamin C as a preventive in those who get gout, or if you chronically get gout, you could almost use this in some ways as a treatment. And certainly at the RDA recommendations, which is so you don't get scurvy, is 60 milligrams. You won't get very far with that. You want to probably take a couple thousand milligrams a day at least, depending on who you are and where you are and what your problems really are. But certainly vitamin C can be very helpful in preventing gout attacks, and we think that's probably the mechanism of action that we see with the use of the cherry bark extract, and also we see with the fresh or even dried cherries, is that they're very high in natural vitamin C, which can do wonders to change things. In fact, that's always a big debate in vitamin C, is what is a natural form versus, taking ascorbic acid, which is out there. And there are many who would suggest that, vitamin C of any type is perfectly fine. And then there are a few that say, listen, the best way to get vitamin C in your body is what's naturally found in the environment, like what's found in rose hips, for example. And occasionally you will see vitamin C sourced from rose hips. To be honest with you, I'm on the fence in either direction. I've seen vitamin C, even from ascorbic acid, work wonders for a variety of problems, even compared to the people taking a natural form of vitamin C. So I say either one at this point in time. What else can you do for gout? One thing I've seen work well in patients who have gout, one, if it's just an acute occurrence and you've never had it before, then it's also a timeline to say, what am I eating as far as a diet? But obviously mainstream drugs that are out there, there's allopurinol that's been around for a very long time that can work very well for an acute gout outbreak. And also Uloric is a newer drug used to treat gout, which I would suggest compared to, I don't prescribe drugs here in the state of Alaska as a naturopathic doctor, but I've seen enough patients who take these drugs. And I would say allopurinol, even though it's older, works just fine. I don't see it being any less effective than the new drug out there, Uloric. In fact, I would say Uloric works not nearly as well as allopurinol does, and those having acute gout attacks. Now, if you're chronically getting gout, that's getting back to what are you eating as far as your diet. It's a high in protein. Are you drinking alcohol? And not just red meat as far as the protein piece of that story. So those are things to consider. And obviously staying hydrated for chronic acute attacks of gout. And, of course, taking vitamin C would be a good reason as well to that. And, by the way, baking soda could also help dissolve some uric acid kidney stones. And that can take in some small amounts to make you more alkaline. It seems that if we get the urine more alkaline in a lot of patients, they tend to have an improvement in uric acid stones not occurring, and also a decrease in inflammation associated with those getting gout attacks. And not to confuse anybody, but again, uric acid can cause gout, and you can also have uric acid kidney stones. So baking soda could be used in both those directions as small amounts. What's a small amount? Like a half teaspoon twice a day, And when I say alkaline, we're talking about the urine. You're not going to change your blood pH by much. And when people talk a lot of times, well, I'm getting alkaline, or, I'm acidic, that's based on either a salivary pH testing or a urine pH testing. You're not going to get your blood alkaline. If you did, you'd be in the emergency room. I mean, that's how tightly controlled your pH is in your blood. And I think it's somewhere between like 7.15 and 7.45, I think, are the ranges for pH in the blood. And that's where things stay at. But you can see big shifts in urinary pH, anywhere from even, say, 5 up to like 8, 8.5, which are big changes. And anybody out there on the uric acid side of things getting kidney stones from those, definitely getting your urine more alkaline would be a great thing to be doing. And it'd probably actually help with the gout as well. Being more alkaline based on your urine actually tends to bode well for helping inflammation be decreased. And I've even seen pretty acute arthritic attacks in some patients respond very well to the use of baking soda, and even including apple cider vinegar, even though it sounds kind of counterintuitive because vinegar is acidic, but yet in the body it creates alkalinity in the urine, and it's in general in the system, it seems. So things to consider. So besides taking dried cherries or fresh cherries for gout, you can certainly look at taking vitamin C, taking baking soda as well. And obviously staying hydrated. So some of the great things there to consider in doing to prevent gout. All right. Again, just today, this is Dr. Michael Ellenburg. It's a medical show here on Fox News Talk 1020 AM. You also find us on FM at 95.5, and online you can live stream us at foxnewskoan.com. That's foxnewskoan.com. Our phone number here at the station is 522-1020. It's 522-1020. Questions, comments about your health, comments about our topics, give me a call. I'm happy to talk to you today. It is a live-in show. We do encourage your phone calls. While we wait for some phone calls, let's talk about vitamin D. And I think it's a good reminder that in the winter, especially in Alaska, and all of Canada included, that we need more vitamin D. And the reason that is the sun is what stimulates vitamin D production to begin in your skin. And it's a specific type of ultraviolet radiation known as UVB, and there's A, and there's B, and there's C from the sun, and C does not make it down to Earth. It gets absorbed by the ozone layer, and A and B get through most of the year. And due to the fact that we're so far north on the globe, in the winter, which starts here, September, pretty much through April, we hardly get any, mostly we get none, basically in the dead of winter, no UVB radiation from the sun because the ozone layer absorbs all of it. And so even on a bright sunny day, like today in the Anchorage area, and you went outside and say you were brave enough to get your bathing suit on and sit out in the sun, you would get no vitamin D made in your skin at all. So it's important to remember that, in the winter, we tend to recommend that our patients increase their amounts of vitamin D. And again, you say, well, how much should I be taking? Well, we have all these different parameters, right? We have what the RDA says. The recommended allowance says, well, if you take 400 international units a day, you won't get rickets. And that's a disease associated with a deficiency of vitamin D. Now, we want optimal health, what we're after. And we're suggesting, and so are other providers out there, at least 2,000 IUs a day for adults is a reasonable thing to be doing. Unless they're prone to kidney stones, and maybe they cut that dose down in half. Some need a lot more than that. And what's important to realize is that, really getting a handle on vitamin D, and, not most of us, unless you're, over the age 50, are not getting blood work done yearly. But nonetheless, it's just one lab that I would have even probably some young adults get done, even age 18 or 17, say, hey, where's your vitamin D levels at? And let's properly dose you. We know vitamin D is involved in inflammation. We know vitamin D is involved in brain health. So depression and anxiety are linked to it. We know it has an involvement in cancer, heart disease, type 2 diabetes. I mean, the list is going on. And the reason you might ask yourself, why is vitamin D involved in all these different things? Well, vitamin D really is not a vitamin. It's actually a steroid hormone. And I don't mean like cortisone. I mean, it's literally a steroid hormone action in the body. So it's, has far super... it's not superseding, but far-reaching effects in the body, in a sense, in comparison to, let's say, even B12. It could say, well, that has far-reaching effects, but it's not really a vitamin. We should call it something else. I'm not sure what we should call it right now, but until then, let's find something new. We're going to call it vitamin D. So vitamin D has many far-reaching effects, and getting a laboratory test done to see where you're starting from is a great way to begin to see, okay, how much vitamin D should I be dosing? There were 2 articles recently I was reading about, and it's not about the common cold. We'll get that in just a minute. Talking about toxicity. And so you have a lot of fortified dairy products of vitamin D, and occasionally what will happen in these facilities is that someone will get high amounts of vitamin D will be added into different products inadvertently, by mistake, usually because someone doesn't understand the difference between micrograms and milligrams, which is the 1,000-fold difference. And there were 2 studies on 2 people in particular who were getting I think almost 1 million units of vitamin D a day, and then they weren't taking that. They got tainted fortified vitamin D products that were super physiological levels of vitamin D, almost 1 million units a day, and they did get toxic, and they lost weight, they had fatigue, they had joint pain, they had nausea, and what was interesting is that all those, and they were around 800 on the scale for vitamin D, which is 8 times the high end of normal. So the vitamin D scale right now for a blood test, this is a long name, 25-hydroxy vitamin D. It's the kind of vitamin D test you want to do. The high end of that test is 100. Low end of that test is 20. And at 100, we're talking about, vitamin D. That's the high end, so they were 8 times that in these individuals who were taking this high amount in overdosed vitamin D fortified products. All of the symptoms went away when it got down to 400. And one argument is maybe 100 isn't really the top end of the level. Maybe it should be 200. So we're still trying to figure that part out. But I would suggest, what do I think? Well, I think that as far as levels to be at, I try and get most of my patients to get their vitamin D somewhere between, say, 60 to 80 in the range. And certainly those under 20 need a lot of help to get there. And typically 2,000 IUs a day of vitamin D, and a standard adult will not do it. You'll need a different dose. And again, we're not here to practice medicine over the radio. We're here to educate you about your health. And to learn more about your vitamin D levels, get a blood test done. You can do it even at local labs without a prescription from your provider. So check that part out. Now, about 3 weeks ago, we had all this big hullabaloo over vitamin D being touted as not being helpful in the common cold. And you had all these different headlines, vitamin D, beat by the common cold, vitamin D not useful against the common cold, all these different headlines that were out there. And it was in a study that appeared in the Journal of the American Medical Association, known as JAMA, this early part of this month. Now, there's some problems with that study. And the problems are what they do, first of all. So they randomize people. That means they pick people who were getting the actual vitamin D and those who were getting placebo, meaning you're getting basically nothing pill. And the study was done in New Zealand where they were giving people 200,000 units of vitamin D for 2 months, followed by 100,000 units IU per month of vitamin D for 16 months. So they were roughly getting, in the first month, about 6,300 roughly IUs of vitamin D a day. And then in the next 16 months, they were getting about 3,000 IUs of vitamin D a day. And what did not happen, was hoping to see in the study, is that to be a reduction in the amount of colds that those in the active group with the vitamin D got versus those who were taking placebo or nothing. And what they saw, there was not much of a difference between the control group and the treatment group. Now, what's been done with the study is Dr. John Cannell is an MD who started the Vitamin D Council.com. That's vitamindcouncil.com. Check it out if you're interested in vitamin D. Great articles on there and information about vitamin D. Is that when you look at the group who's actually the control group, meaning they were getting the placebo, they actually had levels that were fairly close, or actually they were almost in range at about 30. And what does that mean? Well, they were almost in range. They got nearly as many colds as those who were taking vitamin D in the other group. And what this might mean is maybe how vitamin D is effective in patients is the fact that if they are low in vitamin D, very low in vitamin D, that they need that's where vitamin D will be more effective versus those who already have sufficient levels or are in range for vitamin D and not being effective. That could certainly be part of it, and I think it probably is. So you have a fairly strong control group compared to those who was a treatment group in the first place. And I think right there are where the problems arise. Now, that's what we're looking at. What are other studies that have been done? Of course, nobody mentions these studies when they blast this up on CNN or Fox News or whatever the mainstream media you want to watch, which I don't watch any of that, by the way. There's an article that came out in January of last year in The Lancet, which is a British journal, that found a 6-fold reduction in upper respiratory infections in people who were taking or who were severely deficient in vitamin D to begin with. And so they had a massive reduction in vitamin D. And then beyond that, we had these 2 studies that came out of Asia. One was both in children, one in Japan and one in Mongolia, that both demonstrated that children given actually low doses of vitamin D daily showed a significant reduction in their occurrence of upper respiratory tract infections. So, what I'm getting at is, don't necessarily say, okay, well, we're going to stop taking, vitamin D. We think it's worthless, not preventing cold. Well, it's beyond that, okay? It has many other functions in the body, but I'm not going to take away from my statement I've said many times here in the show. I talk about the flu vaccine, which is a useless vaccine in my opinion, that each year, if you want to prevent the flu during the winter, is to take a fair amount of vitamin D. And what's a fair amount? That's based on what you need individually, meaning you've had a blood test done to see where you're at, okay? And that's where you want to find things out with your vitamin D. And then you know how to dose it appropriately. So there's one article. We got about 4 minutes before we go to our break here. And again, if you got any questions or comments about your health, the number here at the station is 522-1020. It's 522-1020. Give us a call with your questions about vitamin D or about your health. That's fine. We can change topics. No problem doing that. And while I wait for that, let's just finish up this last article here on vitamin D, which is a short one. Dr. Alan Gaby, who's a pretty famous guy in the world of integrative medicine and one of my teachers from Naturopath Medical School. He's an MD who's been involved in nutrition for over 30 years, and he's got a master's degree in biochemistry from Emory University, and I forgot where he got his MD at, but very smart individual and does a great job at trying to ferret out good data. And he looked at a really large study, probably the largest one I've ever seen, I think, on measuring vitamin D levels in people. And this study came from Denmark, Copenhagen, where 250,000 people had their levels of vitamin D measured by their GP or general practitioner between the years 2004 and 2010. And there was a follow-up period of time of about 3 years. And what they found is about 15,000 of that 250,000 people in that group died of various things. And what they found is there seemed to be an association between the levels of vitamin D and someone's increased risk of death, mortality in this case, for all causes. And what they kind of found in the study was that those who had levels that were somewhere between 50 and 60 on the scale for vitamin D tended to be the best ratio for having a decrease in all-cause mortality versus, though, at the lowest end, those at the highest end, which, is kind of surprising. And, it's not saying that, vitamin D is not effective at higher levels. It's to say here's one study and here's what they found as far as the results. What I found interesting about this article from Dr. Alan Gaby is that I did not notice before is that actually 25-hydroxy vitamin D in this case we measure actually in the blood can be involved in inflammation. And so if someone has a lot of inflammation in their body and they have this level measured on a blood test, it can actually be decreased. It's being used up at a high rate by the body to combat inflammation. So if someone were to go in and you have a lot of inflammatory problems like joint pain or you have low back pain or you get a couple of really bad chronic teeth, for example, that are really inflamed, you might have a low vitamin D level because your body is using that up, which is interesting. I've not heard this before, so it was quite surprising to read about that. And it makes me think about people from now on when I check their vitamin D and they get really low levels. If they're taking vitamin D and levels are real low, they probably have a fair amount of inflammation, which we could ferret out actually with some more testing and blood testing, as a matter of fact, to check for inflammation in the body. Some very simple blood tests for that are a C-reactive protein, or CRP, and a SED rate, or ESR, are great for measuring inflammation in the body. And those are some really good things about vitamin D tests. And the bottom line is taking vitamin D may decrease your risk of death. So there's our sign that it's time to take a break here at the bottom of the hour. We're back in a couple of minutes with more information about your health. Hold on there. Hi there, folks. This is Dr. Ellenburg. Welcome back to our medical show here on Fox News Talk 1020 AM. Also on FM 95.5. You'll find us online at foxnewskon.com. Hey, we're having trouble with the phones today there, so if anybody's tried to call in with your questions, we do appreciate it, but we can't hear you because we're having phone trouble. So the 522-1020 will not working, I guess, for this part of the show today, so we'll just listen to me talk. So I know you can hear us out there, but sorry on the phones. They'll be working next time we have our show. All right, so today's show so far, we're going to go back over and get talking about diabetes, depression, and magnesium, weight loss, and lead levels in our bodies. If you missed the first half, we were talking about vitamin D, still being shown in other studies. So the one recent one was in JAMA to actually help with the common cold, and also decrease overall mortality in those taking vitamin D who have certain decent levels of vitamin D. And we discussed gout using cherry bark extract, fresh cherries or dried cherries, vitamin C, and baking soda as possible things to be doing besides taking allopurinol. However, that drug can work very well on those having really acute attacks, and I'm certainly not downing that drug. If you need to get on it and you had really bad pain, I'd probably be trying it myself first and then have my other ones as adjuncts to help out on the way. And if you have chronic gout, consider those things: vitamin C, cherries, dried, fresh, extracts, or baking soda at small amounts as well for inflammation to help out with that. All right, well, let's talk about type 2 diabetes, depression, and magnesium. When I first started learning about magnesium back in naturopathic medical school, we would say, well, we know magnesium right now is involved in over 150 reactions in the body. And then a few years later, it was 200. Now we know that magnesium is involved in over 300 different reactions in the body. 300 different reactions. Well, what's so important about that? Well, the importance of that is we actually need a fair amount of it on a daily basis in our diets through either food or supplementation to be used. So the reason it's important is we're going to have a lot of people out there with low magnesium, also known as hypomagnesia. So they have low magnesium levels in their body. And the RDA for magnesium, which I thought I knew, I was wrong, is 350 milligrams a day is the RDA for magnesium. I was like, wow, I didn't know it was that high. And it is. And food-wise, where do you find magnesium? Well, you find it in nuts, seeds, dark green leaf vegetables. So spinach obviously is a good choice. Collard greens, kale, broccoli would be a good source of magnesium. So a lot of different places, but a lot of people aren't eating those things. And again, as I mentioned, magnesium is used in so many different types of reactions in the body, we may need to actually have a number of people actually taking it as a daily supplement if they're having problems. Now, one of the first signs that I tend to see more commonly in patients that have low magnesium is nighttime leg cramps or nocturnal leg cramps at night, charity horses, whatever you want to call them. And that frequently we'll see when we get patients correcting their magnesium levels, those go away. Now, occasionally those same problems are related to low potassium, but more times than not, it tends to be magnesium. This is one sign to look at. What else? Some bigger signs. Fatigue, do lots of things, but can be due to the fact that someone's low in magnesium. Just overall low energy, which is not quite like fatigue, but something close to it, maybe not just slightly under the radar as far as problems. Muscle strength could be involved in that. Liver function can be compromised in those who tend to be more toxic if you're exposed to a lot of chemicals in the world you live in. Magnesium is used by your liver to help your body detoxify itself every single day, and it's one nutrient we give a lot of patients who are doing different regimens of detoxifying their body. We have them at higher levels of magnesium. So there's some simple things that's involved in. But an article appeared in the Journal of Nutrition here this year in June, looking at correlations between magnesium intake with, as they coin here, metabolic parameters, depression, and physical activity in the elderly with type 2 diabetes. What are metabolic parameters? That means things on how well your metabolism is actually working. And patients who have type 2 diabetes, which we're going to define further and say type 2 diabetes is known as insulin resistance as of right now, meaning your liver, your fat, and your muscle cells are not sensing insulin properly. Insulin secreted from your pancreas tells your liver, your fat, muscle cells to store glucose. Also involved in how you burn fat as well in that sensitivity piece. So those metabolic parameters can be affected. And one right off the bat I got to mention because I totally forgot about it from the past, and that is those of us who suffer from hypertriglyceridemia, meaning those who have high triglycerides, who aren't diabetic, for example, you might be low in magnesium because magnesium is involved in how lipids are processed in the body. And so if you're out there, with high triglycerides and you're doing things right with your diet, exercising, doing things right, why are they still high? Well, there are genetic familial issues people can have with certain types of high triglycerides, but maybe, just maybe, you're low in magnesium. Now, how would you test for that? In this study here, they use a serum magnesium, which is not my favorite, and even they themselves say serum magnesium may not always find low magnesium in a lot of people. In fact, I would say it doesn't most of the time. We had it as part of our health panel from 2004 till maybe 2009, almost 5 years or longer. And I think in that time, I might have seen one serum magnesium that was actually low. When we switched to measuring magnesium levels in red blood cells, known as an RBC magnesium, which is a very standard test that can be done in any hospital or any lab you can get a hold of, RBC magnesium, we started finding a lot more people low in magnesium. In that case, we started seeing, we had roughly 25 or 30% of the folks who were actually low in magnesium. Or they were on the lower end of the scale. And the scale for that magnesium levels typically for RBC magnesium something like about 4.0 to 6.5. And I want to see folks at least up in the 5 or 6 range. If they're down anything under 5, I'm going to say you're deficient in any more magnesium. So it's important to understand how we can measure it. You can also measure magnesium levels in the hair as well, but the main way we're using it in our office is RBC magnesium. So in this study, what was done? Well, this was a study that looked at a subset of the diabetic population, 210 folks with type 2 diabetes who were aged 65 years and older. They were interviewed on lifestyle and also had a 24-hour dietary recall of what they actually ate. And they also checked blood pressure, height, weight, all that good stuff, urine testing, and looked at their relationship of magnesium intake with a variety of the variables as far as dietary concerns. What are some key findings? And I want to spend some time on this article. It's a really good article. So one was about 89%, okay, that's almost 90% basically of folks in the study consume less than a dietary reference intake for magnesium. 90% were not getting enough magnesium in the first place. That's huge, okay? That's a big number. 37% or 40%, if you round that up, had low magnesium, known as hypomagnesemia. We'll say low magnesium for short. What else did we see in this study? We saw that there was a relationship between magnesium intake and the level of HDL cholesterol, known as good cholesterol levels. We also saw that magnesium intake was inversely correlated. That means if it was low, people had higher levels of triglycerides. They may have had larger waist. They may have had a larger body fat percentage, and also the BMI, known as body mass index. And they also noted that magnesium intake was related to a high physical activity level and demonstrated lower serum magnesium levels. So if the intake with high levels of activity was great, they also were demonstrating the same people that was being used a lot, and they had lower levels of magnesium. But they also found out that the serum magnesium, as I mentioned before at the start of this little piece, was not associated with a change in metabolic parameters or changes. So again, not recommending a serum magnesium to test your magnesium levels. I think it's kind of an outdated test. And as the author state here, they conceded that the test can be highly inaccurate and not definitive. That means not demonstrating or showing someone having a problem with magnesium. And besides diabetes, what else has magnesium been involved in or associated with? One of the big ones is high blood pressure, known as hypertension. And in patients who present in my office with hypertension or high blood pressure, we always talk about their intakes of magnesium and potassium. And potassium is a test frequently measured on a laboratory panel called a complete metabolic parameter, or CMP these days. And potassium is another area where I think a lot of the reference ranges, what it should fall in from normal, I think it's low. It starts at about 3.5 and goes to, I think, about 6 or 5.5, depending on what lab you use. I really think it should start at 4 and maybe even 4.2, 4.3. And it should be a very tight ratio on potassium. And many people, when we have them correct their potassium levels by taking a supplementation, coconut water is really high in potassium, for example. A good natural source are avocados, cantaloupe, bananas, that once those are improved, and those people who don't have leg cramps associated with low magnesium but associated with potassium, those improve. And a lot of times energy actually improves at a better potassium level. Potassium, just for digression here for a second, is used by every single cell in your body for transmission of many different things across the cell membrane. It means the cell wall of your cells, so it's highly needed throughout your entire body. So people with low potassium are going to feel tired, wore out. But back to magnesium here. So we mentioned high blood pressure. We mentioned diabetes, of course. We mentioned people having, in this case, lipid abnormalities. That means problems with high cholesterol, problems with low HDL, problems with high triglycerides. And that magnesium actually has a hand and is involved in that. And what we also found out with the study, which is demonstrated before, is that if magnesium levels were low, there increased risk of type 2 diabetes, people having a lot of abdominal obesity, and, of course, having low HDL. We also found this in those who had what's called hypomagnesemia, or low magnesium. So, again, some reminders on the RDA. The RDA for magnesium is 350 milligrams. Many of us are not even getting that, and they're suggesting in the study that those with conditions like type 2 diabetes, like high blood pressure, those with high triglycerides might need even twice that amount. Okay. Now, with magnesium, you want to be careful if you're going to start taking it because it can cause loose stools. You wouldn't want to take, if you don't take magnesium and say, well, I'm going to take some, I think I need it. Well, don't go out there and be taking like 300 milligrams at once because you might end up with diarrhea. Usually recommend a smaller amount, although if you are low in it, and again, how would you check? Remember, RBC, red blood cell, RBC magnesium level, be the thing to have done in you. And if you have type 2 diabetes, high blood pressure, high triglycerides, or low HDL, you should have a you should have a RBC magnesium test done and see where things are at. Rule it out as part of the picture. If it's normal, it looks great, don't worry about it. Then see what else is causing those problems, right? And one of the biggest areas in that group right there is high blood pressure. I see that so often in my practice. People come in and they'll have a secondary problem, will be with the high blood pressure. Well, why do you have it, right? You're not deficient in lisinopril. You're not deficient in Coreg. You're not deficient in lisinopril. You're not deficient in Altase. You're not deficient in, you get the idea, right? These are drugs treating different types of high blood pressure. But you have that for a reason, and that needs to be looked at. And maybe, just maybe, it's magnesium. Imagine that. Different forms of magnesium. Some comments. We tend to like the best magnesium citrate. Magnesium oxide, very common in a lot of supplements out there, is not very well absorbed. Only about like 10% gets absorbed. There are some chelated forms of magnesium which can be helpful. However, if they're bound to certain types of amino acids, that could have an effect on neurotransmitters in your brain. So I would vote straight on the board magnesium citrate as far as an oral supplementation. To get magnesium into your muscles at a higher rate without having to actually consume it orally, you can soak in Epsom salts. Epsom salts are magnesium sulfate. Yes, grandma or great-grandma was right about soaking your feet or your body in Epsom salts. They actually work. So in those who do a lot of running or high exercise, or in general don't take any magnesium whatsoever, you might want to consider Epsom salt baths. And you can read on the side of the bag how to appropriately put that into the water. And yes, it can soak directly into your muscles. There's also even a transdermal applications of magnesium. You can buy in a liquid form and you can absorb magnesium right into your muscles from oil on your skin. Pretty neat stuff. So again, if you have type 2 diabetes, definitely recommend considering magnesium. And I forgot to mention this article, was looking at depression. And many of the type 2 diabetics had depression as well. And there's indications that supplementing appropriately with magnesium could also improve depression. And that's not one I have looked at in the past. And typically in patients who see me in my practice, we consider vitamin D for Alaskans to be a huge issue with depression or anxiety, thyroid function, how is your adrenal function, how much sleep are you getting, what kind of diet do you have, but definitely got to include looking at low magnesium as being a cause of depression. So that'll be a new one I'll be looking at in patients more often than I have did in the past. So hope you appreciate that part there. We have about 10 minutes left in today's show. If you tune in today, we're having problems with the phones. So I'm not going to mention the phone number because we can't hear you, unfortunately. And we'll get it figured out for the shows here later today. But if you do want to listen to us online, of course, always find us at foxnewskon.com, live streaming. And you can also find us, of course, here on 1020 AM and on FM at 95.5. We got about 9 minutes left in today's show. Let's get into the couple articles here talking about about weight loss and things that can affect that. And the first one being sleep. So a good frequently emailed free newsletter weekly is a Web Doctor, Web, W-E-D, E-B, doctor, spelled out, webdoctor.com, and they had a great article entitled, Even Your Fat Cells Need Sleep. And in this particular study, a very interesting study, from the University of Chicago Medicine, performed a study using looking at young, lean, healthy adults who each went through 2 study conditions. One where the people in the study were sleeping for 8.5 hours a night for 4 nights in a row, and another study where they were only getting 4 hours a night for 4 nights. And each of the morning after those first 4 or the second 4 study conditions was done, people in the study were given a test called a glucose tolerance test, which measures your ability of what your body is doing with insulin sensitivity. And what they demonstrated is that the people who had shortened sleep had a decreased response to insulin by 16%. And the insulin sensitivity of the fat cells decreased by 30%. And those who had 8 hours sleep had no problems with the levels. They were normal for them, and they were not decreased. So a demonstration that even your fat cells need to have sleep, as well as the rest of your body. And if you're not getting proper rest in general, I will tell you it would be very hard to lose weight. And the other problem involved with that too is it can affect your adrenal function over a period of time, and that's cortisol is also involved in helping your thyroid function work. So it's all interrelated. If you're not getting good sleep and you're overweight, get that sleep part corrected, because it'll be easier for you to lose weight if you're getting a better night's rest. That article appeared in the Annals of Internal Medicine this month, 2012, this year. So aim for at least a solid good 8 hours of sleep a night. If you're not getting that, get checked out. See why you have insomnia. If nothing that comes up big as far as a main condition, consider things like the following. Again, talk to your doctor appropriately, but things like melatonin, valerian root. There's other different types of nervines that are types of botanicals that can be very helpful for sleep. Make sure you don't have hyperthyroidism. Biggest thing usually is diet. Make sure you're not taking things later at night that keep you up, like drinking a lot of coffee and soda pop and stimulants and a variety of things that will keep you up in the middle of the night. Make sure you don't have sleep apnea, because that will definitely affect your solidness of your sleep, because if you do, that can be treated. And sleep apnea untreated can lead to a whole host of problems, such as type 2 diabetes, high blood pressure, and even death. So get it looked at. But sleep's so important for you, including in this case, not only for your whole body, but also for weight loss. What else is good for weight loss? Well, one thing I frequently see a lot of people is I'll talk to them about their diets somewhere in our interview process for the hour and a half we're sitting down on the first office call when they see me, and say, well, what do you have for breakfast? And I tell you, I would say more times than not, the answer is nothing. Then I'll hear, what do you have for lunch? Well, I usually have, half a sandwich or a cup of soup. I don't have time. I may not have it. Or, so a lot of people end up only eating, one meal a day. And guess what it is? It's at dinner time. Now, unless you're working the night shift, that makes sense. If you're not working the night shift, it makes no sense, because now you're active most of the entire day. You're going to come home, you're going to have a big old meal, you're going to sit down and hang out, and guess what? You're probably going to fall asleep. No, that might happen too, but you're going to be burning less calories and less energy, and long term, you will gain weight, slowly but surely. Most of you will out there if you're doing this. And the importance is you want to make sure you have breakfast. I don't care if it's a small breakfast. You're priming the metabolic engine in your body by having breakfast, okay? And breakfast is not a cup of coffee, right? Or a cup of tea for that matter. I'm talking about substance. That would mean things like oatmeal, a bowl of cereal, hard-boiled eggs, the like. I don't mean going to a fast food place either and getting a breakfast burrito, okay? That is not a healthy choice for breakfast. But the point being is getting something healthy in the morning, even if it's something quick, on the go for it. I've spent many times over the years the type of thing I've done for a long time, though I switched up recently to different things, but where I make a smoothie in the morning. Smoothie would include either rice milk or goat's milk or almond milk, one of the three, whey protein powder and or hemp protein powder, a tablespoon of almond butter, blueberries, and a banana. Mix that baby up, drink that. I'd be good for 6 hours or 4 or 5 hours until 2 o'clock in the afternoon. I'm set, and that's getting me set for the rest of the day. Now, what I try and do is practice that last one, and that is, well, one is eat breakfast, eat lunch, and at dinner, eat less. Unless you're going to be very, very active in the evening after you've had dinner, there's no reason to stuff yourself in the evening. And if you did nothing else, for those of you out there who are trying to lose weight, and I know it's hard for you, for a lot of people to lose weight, is change the amount of food you're eating at the times when you're doing it. And that is, eat breakfast, eat lunch, and one of those two should be the biggest meal of the day. And third, when you have dinner, eat a third less for dinner. Heck, eat half as much for dinner. You won't starve. And when you get in the morning, they'll say, well, I'm just not hungry when I get in the morning. Well, guess what? That means you're eating too much food at night. Okay? If you're not hungry in the morning, you're eating too much food at night. That's very clear. I mean, try it out. I mean, even try eating, like, say, lunch and breakfast and skip dinner. And say for the morning, you're going to want to eat in the morning, okay? And what we saw from a study here that appeared on the site naturalnews.com was a study out of the Imperial College of London that found that breakfast was by far the most important meal of the day. And it also deterred cravings for binging and other unhealthy junk foods, as I mentioned here, the rest of the day in those who were eating breakfast. And again, why is it helpful? Well, it stimulates a good blood sugar production and control, regulation. You get things moving in the morning, get the ball rolling. And they even demonstrated in an article here, they said years ago here, in 2003 at the American Heart Association's annual conference, that breakfast can actually help reduce the risk of type 2 diabetes and different types of cardiovascular illnesses. Okay? Just eating breakfast. All right? Just eating breakfast. Imagine that. So make some time for yourself. If you have a hard time, here's another one. You can take a dozen eggs, hard-boil them up, eat eggs for breakfast. All you got to do is grab those, put them in a plastic bag, you're out the door. Eat when you get to work or eat before you go to work. It takes like about 10 minutes. So people say, I don't have time for breakfast in the morning. Yes, you do. You make time for it, okay? Your body is only resilient for so long until you treat it effectively and in a nice way, right? If you're not doing that, after a while, it's going to break down. So eat breakfast, eat lunch, small dinners, okay? Small dinners. And those of you who have, grandma and grandpa who are in good health and are older, ask them what they're doing. They're doing exactly that most of the time. Breakfast, lunch, sometimes no dinner. Check them out with them. All right, we got about a minute and a half left, 2 minutes. 2 minutes, all righty. Quickly on lead, and then we'll tell you how fine we're doing the rest of the week here. But CDC, Center for Disease Control, updated guidelines for children lead levels, and they cut the value down in half. So before they were saying if someone had 10 as far as a lead level in their blood, it's now at 5. And why is this important? Because we do know there's a bunch of studies that associated lead with behavior problems, ADHD, cardiovascular problems, immune system dysregulation, and even hormonal problems in the body. So lead's affecting those things in a variety of ways. And it's not to say that those out there who are adults should also consider having their lead levels checked. If you have lead in your blood at any level, even 1 or 2, that means you have a current exposure somewhere in your life. Either it's from food, it's from water, it's from your house, your job you do, whatever it is, you're getting exposed to it, because if you have it in your blood, it's only from what you've been exposed to in the last 45 to 60 days. If you're an older adult, what's older? I mean, it's over the age 65, and you have a fair amount of lead in your body, and you haven't worked on nothing for years, or you're not doing anything. Lead's also involved in cigarette smoke, by the way, folks. If you are older and have lead in your blood, it could be coming actually from your bones. Lead is stored in our bones in the majority of places, as well as our brains. All right. Next week, we'll cover more of this article again, folks. Sorry for the problem today at the phones. Next week, we'll get those working again. Thanks for tuning in. To find during the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Website address is drellenburg.com. And again, we'll see you here next Monday from 2 to 3 p.m. Have a great week. All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on